Well, the CDC is asking everyone to get their flu shot this year, but it's making a special effort to reach out to Black and brown communities that are less likely to get vaccinated.
Our social equity reporter Micah Smith joins us in the studio. And Micah, you talked to a doctor from the American Medical Association about this effort.
Yeah, Molly and Brian, I talked to Dr. WILLIE Underwood III, and he told me during a severe flu season, there's been as many as 41 million illnesses and 710,000 hospitalizations among Americans. Now, you add a pandemic on top of that, and Underwood says low vaccination rates will lead to a startling increase in deaths and hospitalizations for healthcare systems that are already overloaded. Dr. Underwood says right now about 55% of the white population have received their flu vaccine, but just 40% of the Black population and 38% of the Latino population have received the flu shot. Underwood says, as with the COVID vaccine, there are a number of reasons flu vaccination rates are low in communities of color, including misinformation, poverty, and lack of trust in medicine. Underwood says he understands why communities of color are skeptical, but it's so important to get vaccinated.
So the real conspiracy is to not get it, right? That's the crime. To die disproportionately, to be sick disproportionately. Why? Because you just didn't get the vaccine, because you allowed someone to trick you into believing that it was more harmful to you than it was beneficial.
Underwood says you can get the flu and COVID-19 vaccine at the same time, and in fact, he recommends it.
So Micah, did the doctor say the flu shot had any benefits regarding COVID-19?
You know, we've talked about this a lot. Dr. Underwood says there's no direct benefits to COVID-19. However, if you get the flu shot and you get sick, doctors can go ahead and rule that out and begin treating you for COVID-19 and vice versa.
Right.
They can rule out COVID-19 and you can go ahead and skip that 14-day quarantine.
Move that process along a little bit faster. Thank you, Micah.